Hi, my name is Dr. John Runback from American Endovascular and Amputation Prevention. Pedal loop interventions can really help with limb salvage and limb preservation in patients with non-healing wounds due to diabetes, chronic kidney disease, and other conditions. The pedal loop are the arteries in the foot that are the end arteries of all the blood supply down to the foot, and therefore responsible for supplying blood out to the toes and to the heel. Patients with blockages in the pedal loop due to diabetes and other conditions therefore can develop wounds, ulcers, or gangrene that don't heal without restoring blood flow through this pedal loop. While not every person needs a pedal loop intervention, there are certainly individuals when the wounds don't heal that this type of intervention is extremely important in order to provide the best results. And most notably, it's a procedure that not that many interventionalists are comfortable performing due to the small diameter of these arteries. It requires specialized expertise, tools, and experience.